Cancer is basically the kind of malignancy we see in today's world. Plus, cancer has been there for ages also. So, basically, അതിൻ്റെ ട്രീറ്റ്മെൻറ്റും അതിൻ്റെ കാര്യങ്ങളെല്ലാം നോക്കാനായിട്ട് അത് കഴിഞ്ഞിട്ട് when the patient is terminal, when he has, there's nowhere to go and he's told to go back home, അതാണ് നമ്മളുടെ palliative care ആണ് വരുന്നത്. So that's where the palliative care actually begins, at the time of diagnosis of the patient with cancer till his very end. And it doesn't cover just the patient, it covers even the family also. Cancer pain is the most crucial pain that a patient can ever feel. That's because mainly the organs are all being eaten up because of the cancer tissues. They're all being spread all over the body. More and more organs are getting affected. So, that's how the patient starts developing incorrigible kind of pain, which we need to also take care of. So there are multiple medications that actually go in, and we can actually control the pain in cancer. Mostly patients are quite aware these days compared to what it was before as to the cancer and its development. Signs and symptoms normally like weight loss, any kind of loss of appetite. Sometimes people can cough out blood. They can have kind of swellings on the body, and some unusual kind of growth. Sometimes they can be bleeding. When they pass motion also they can be bleeding, or they can be bleeding from anywhere else of the orifices. They can be a number of symptoms that can actually tell them that there is something wrong, that there's something unusually happening with themselves. So when they go to the doctor, they actually run some tests. Even with normal blood test, namukku parnnu manasilakum okay, there is something wrong with you. Pinne namukku mandatory investigations pinneyum cheyum. In oral cancers, nammal head and neck cheyumbethekku oral cancers aanengil sometimes the tongue gets affected. When the tongue gets affected, the nerves that are radiating, it radiates to the face. The ears will get pain, the neck will get pain, the jaw will get pain. These are all nerve pains. Pinna breast aanengila namala there will be pains in the bones, there will be pains on the shoulder, ribs and avade pain varum. Similarly with lung cancer also they have lot of pain on the chest, and then with stomach cancer, pancreas, liver cancer, these are cancers that happen and which are diagnosed at the very late stage, like when they are spread. Karanam these are all silent killers. The pain actually happens like in gastric cancer, stomach cancer aanengila avarkku കഴിക്കാൻ പറ്റത്തില്ല, ഛർദ്ദിക്കാൻ വരും. They can spit out blood, they can vomit blood, they can't swallow. അവിടെ ഭയങ്കര വേദന ആയിരിക്കും വയറ്റിൻ്റെ അവിടെ. ലിവർ ആണെങ്കിൽ what happens in liver is liver starts enlarging. നമ്മളുടെ ലിവറിൻ്റെ പുറത്ത് ഒരു ഷീറ്റ് പോലെ ഉണ്ട്, ലൈക്ക് ഒരു ബെഡ് ഷീറ്റ്. നമ്മൾ ഉള്ളിലിരിക്കുന്ന സാധനം ഇങ്ങനെ എക്സ്പാൻഡ് ചെയ്യുമ്പോഴത്തേക്ക് ആ ക്യാപ്സ്യൂൾ ഇങ്ങനെ കീറത്തില്ലേ, ആ ഷീറ്റ് കീറത്തില്ലേ, അങ്ങനെ കാരണം വേദന. ദാറ്റ് ഈസ് ലിവർ ക്യാൻസർ. പിന്നെ നമ്മുടെ പാൻക്രിയാസും ഗോൾ ബ്ലാഡർ അതെല്ലാം ഇങ്ങനെ സ്വെല്ലിങ് ആകുമ്പോഴത്തേക്ക് എക്സ്ക്രൂഷിയേറ്റിംഗ് പെയിനാണ്, ഭയങ്കര പെയിന്. പിന്നെ നമ്മൾ കോളോൺ ക്യാൻസർ, കോളോൺ ആണെങ്കിൽ നമ്മുടെ ഇൻറ്റസ്റ്റൈൻ ആണെങ്കിൽ നോർമലി ഇറ്റ്സ് വെൻ ദ പേഷ്യൻറ്റ് ഗോസ് ഫോർ പാസിങ് മോഷൻ, ആ സമയത്ത് ബ്ലീഡിങ് വരും, അല്ലെങ്കിൽ ഭയങ്കര ഡയറിയ വരും, അല്ലെങ്കിൽ ഭയങ്കര കോൺസ്റ്റിപ്പേഷൻ വരും. ആ സമയത്ത് they don't feel that much of a pain, but these are the symptoms that they have, like bleeding, excruciating diarrhea, constipation, അങ്ങനെയൊക്കെ വരും. പിന്നെ നമ്മളുടെ ഏനൽ ക്യാൻസർ, അത് ഭയങ്കര വേദന ഉള്ള, കാരണം അവിടെ ഭയങ്കര നെർവ് എൻഡിങ്സ് ഉണ്ട്. അവിടെയും patient cannot bear with that pain. So these are small signs and symptoms that a patient can actually notice. Mostly bone cancers. Most of the cancers avsanam varumbothekku they spread to the bone, and the bone cancers, when they spread to the bone, it's the most excruciating. Emotionally they go down, spiritually they go down, psychosocially they go down, everything goes down. Like namla this is where palliative comes actually. Namla when a patient is diagnosed with cancer, it is a must that even the palliative department or the palliative consultant is being introduced. Karanam, apart from treating the cancer with chemotherapy, radiation, surgery, there is another aspect which the patient goes through. Patient alla, even the family goes through. That's psychosocial aspect, psychological aspect, our emotional, adinte aspect, financial constraints. Adakkellam namukku nokkanam. That is where palliative holds a very strong role. So, when we take care of that part, that psychosocial, emotional, social aspects, പിന്നെ സ്പിരിച്വാലിറ്റി ഉണ്ട്. ഭഗവാനെ എന്തിനാ എനിക്കെന്ന്? That is the question that the patient always asks. Why me? When the palliative consultant looks after that aspect, I'll tell you around 90% of the pain of that patient goes. So we have to go together. There's a lot of counseling, at least daily counseling, madam. We need to be a strong pillar of support for them. As a palliative consultant, we have to be very, very strongly associated with the family. Not only the family, even the patient, pillar, any other thing. Sometimes patient, like they will disclose almost everything to you as a doctor. They will not tell their family what they are feeling. The family thinks, oh, patient does not know anything. So there are so many small things that a patient will feel happy, will feel satisfied when he talks to somebody. So daily counseling is very, very important. It takes time. That is why we have to be with them every day, at least for a half an hour. Adamadi, they'll be more than happy. At least someone is coming and talking to me who understands my feelings. Adana main important. Nammal not only cancer patients, nammal sadharana patients pole, like even diabetes ulla aalkar, hypertension ulla aalkar, endengil oru kuഴപ്പം ഉണ്ടെങ്കിൽ, like we go and we talk for some time, half their mind is clear, they feel happy. Adoru magic actually. We are there till the death end, we are also there after that, because who will look after the family? Avade emotional support vande. So we are there even till then, till they tell us, okay, we are okay now, we can go about our normal work. നമ്മൾ ആ ടൈം വരെ we are there. ഇടയ്ക്ക് വിളിക്കും, ഇടയ്ക്ക് ചോദിക്കും. There are few people, like, see, that's what I'm telling. Like when the patient is diagnosed with cancer, നമ്മൾ palliative department കൂടെ introduce ചെയ്യും. Palliative department കൂടെ introduce ചെയ്യും. പക്ഷേ what happens is, it's basically cancer treatment ഇങ്ങനെ മുകളിലോട്ട് പോകുമ്പോഴത്തേക്ക് നമ്മൾ താഴോട്ടാണ്, we start from below. But when there is no end, നമ്മളുടെ we come up to that level where we are always there for the patient and the family. So sometimes there are patients who lose their hope. They are like, nothing can happen and all those things. But repeated counseling, repeated, pepping up, that actually encourages them. There have been miracles which I have seen also, like, that, even after a certain time of treatment with cancer, and then the doctor says, sorry, there's nothing much we can do. They are also very happy with the basic quality and basic treatment, like pain control or any small things, like, they're very happy even with that. Even after cancer treatment, I've seen patients who live for 3-4 years, aram se they live. When the patient is diagnosed with cancer, it's always better that the palliative department is also incorporated at the same time. കാരണം ഞാൻ പറഞ്ഞില്ല, അതിന് മുമ്പേ അവരുടെ ഇമോഷണൽ, സ്പിരിച്വൽ, സൈക്കോസോഷ്യൽ, all that welfares will be looked after by the palliative team. Any financial constraints also will be looked after by the palliative team. So those inputs also are very, very important for the cancer doctor to improvise on his treatment path. Radiation basically നമ്മൾ head and neck, breast, lung, even sometimes in we give for ovaries, cervical cancers, adukkellam it's very good. So basically that depends on what kind of stage the cancer is in. That depends whether we need to go in for surgery first, followed by radiation and chemotherapy, or we go for radiation first, adu nammal tumor size shrink cheyidittu adu kayittu surgery cheyidittu chemotherapy, angane kore ingane there are different levels of giving treatment with radiation. So adellam oru combined effort aanu, like with radiation oncology, medical oncology and the surgical oncology. Ivaru orumichu oru decision eduthittaanu we finalize as to which cancer needs what. It can be given to n number of cancers, but depending on the stage of the cancer. Side effect, normally the earliest side effect that you can actually see is skin changes. അത് നമ്മളൊരു റേഡിയേഷൻ ഡെർമറ്റൈറ്റിസ് ആണെന്ന് പറയുന്നത്. അത് നോർമലി സ്കിൻ പീലിംഗ് ആയിട്ട് വരും. ആൻഡ് സംടൈംസ് ഇറ്റ് ഗോസ്, അതിൻ്റെയും ഒരു 4 ഗ്രേഡ് ഉണ്ട് സ്കിന്നിൻ്റെ. അപ്പോൾ സോ ഇറ്റ് ഡിപ്പെൻഡ്സ് ഓൺ ദ റേഡിയേഷൻ ഓങ്കോളജിസ്റ്റ് വെൻ ഹി നീഡ്സ് ടു ഗിവ് ഇറ്റ് എ ബ്രേക്ക്. So there are the main changes are blackening of the skin, peeling of the skin. Sometimes it can be so bad that there can be necrosis. അപ്പോൾ അതൊക്കെ എല്ലാം ഉണ്ട്. പിന്നെ ആഫ്റ്റർ ട്രീറ്റ്മെൻറ്റ് the thickening of the skin can happen. Inside organs like suppose if it's a breast cancer, നമ്മൾ radiation കൊടുക്കുമ്പോഴത്തേക്ക് there can be lung fibrosis, ഒരു കട്ട പോലെ വരും in the lungs and all those things. So these are small changes, but that takes a long time to happen. The immediate effect is the skin changes that you will see. Radiotherapy, there is a limit that we give to the patient, which will only produce good effect for the patient. It's not like that radioactive thing we are giving. It's basically a kind of dose that we give pertaining to the cancer and pertaining to the level of the radiation that can penetrate the cancer area. We have radiation physicist and we have radiation oncologist who actually sees scans of the patients and monitor as to which level, because they have to protect. Suppose we're giving lung radiation, we have the vital organ, the heart. We have to spare the heart, right? So they do a sparing portion. It's all physics actually in that. So we spare the vital organs and only give it to the localized area where the cancer is. Adellam nammal spare ചെയ്യും. Nowadays we have such good technologies. It's all like pinpoint അങ്ങനെയൊക്കെ എല്ലാം ഉണ്ട്. Suppose if you take, just now in the morning I had a patient. He was a head and neck patient. It's like a tongue cancer. And so what happens when you give radiation to the head and neck? There can be dryness of the mouth. There'll be full dryness of the mouth. Salivary glands ellam nammal adu nashchu povum. So that and all, everything is being explained to the patient right from the beginning, okay, before we start the treatment. So he or she is well aware of what happens. So that's one of the problems, like there's no saliva, upper taste, you can't get the taste, you can't eat food. അങ്ങനെയൊക്കെ കുറച്ച് ഡിഫിക്കൽട്ടീസ് വരും. ജോ ഓപ്പണിംഗ്, നമ്മൾ വായ തുറക്കുന്നത് മുമ്പേ പോലെ ജോ ഓപ്പണിംഗ് വരത്തില്ല. അത് ഇറ്റ്സ് ബിക്കോസ് ഓഫ് ദ ക്യാൻസർ ഓൾസോ, പ്ലസ് even with radiation also, the jaw opening gets restricted. These are some things. With the breast cancer, what happens is there can be tightness. Adha njan parnja, whenever we give radiation to some areas, the skin gets affected. Pinna oru tightness varum. This is called fibrosis. She or he cannot lift the hand, or there'll be some kind of pulling effect. നെക്കിലാണെങ്കിൽ ഇങ്ങോട്ട് അങ്ങോട്ട് തിരിക്കാൻ ബുദ്ധിമുട്ടുണ്ടായിരിക്കും. So these are small things that will happen, but with regular physiotherapy and all, it becomes all right. We normally ask them to put coconut oil so that the skin becomes softer with time, and it does work. If it's just an MBBS doctor, they wouldn't know what is palliative. I'm not talking just an MBBS doctor, even a post-graduation would not even know what is palliative care, palliative medicine. Because it's a totally different stream of medicine as such, in the sense like you need to know what is it about, what is palliative, why we give palliative. Many people think that palliative aningula or other end stage of the disease, anything like if a patient is lying on the bed, adana palliative. It's not that. We come right at the beginning and we support the patient in the minimal and then go gradually up. And then we also be there even after the patient is no more. So the thing is, when we tell other doctors about this, they don't take it very well. There have been challenges with me even in so many hospitals that I've worked in. But some people accept it, some people don't accept it. Suppose there is a patient who has no more treatment left. Do we need to shift him to the ICU, or will he be better in the house? So I will say that he'll be better if the patient goes to the home and lies down with his family members rather than lying in the ICU with, instruments and machines going in and out of your body. Every day, you have so much of cost every day, maybe around 75,000 or 80,000 per day, depending on the kind of treatment or medications that is going on. But is it worth it for that patient to go there and be in that closed environment in an ICU rather than going and being in their house, in their own environment with their people, with their daughter, son, wife, husband? That is priceless, isn't it? So there comes that challenge because everything is cost, everything is commercialized. So you understand the kind of challenges I have been through. Not many doctors will actually agree. Palliative care is cost effective, is what I can say. Karanam, we don't advise the patient, you go and get admitted in the ICU. We'll tell them go home and get admitted. Our home care team will come and see you. There'll be home visits. If you need anything, we will help you. Any symptoms, we will help you. So I think that's very much cost effective rather than staying in a hospital. I am a Reiki master and I have given Reiki to my patients. And yes, they do feel a lot of kind of a comfort. It's like a comfort feeling. A patient vayangara vedana ulla samayathu, if I give Reiki, they do feel very much comfortable. It's like a lifting of pain or a lifting of psychological, emotional constraints, and they just go to sleep. I've seen that in patients. So it does help lift up a little bit of negativity off the patient and bring them more positive vibes. There are some psychological aspects that normal doctors, medical doctors, cancer doctors do not know. Adundana, this palliative teaches us all about these kind of wonderful things: spirituality, psychosocial, emotional aspects. With music, therapy, gardening, your pets, you get so much of relief. There are so many miraculous things that happens. It's unexplainable. This is not science. This is something more of spirituality. Stress is the main factor of causing this cancer. Stress is very, very dangerous. നമ്മൾ ചുമ്മാ വീട്ടിലിരുന്നിട്ട് ആലോചിക്കുകയാണെങ്കിലും for unnecessary things, that develops irritation inside our body, irritation of the cells in our body. So when there is irritation, it explodes. It's unimaginable. Kerala is very much into palliative care. We are very strong based over here. The father of palliative care, Dr. Rajagopal, who's running Pallium India, is my mentor. I really love him so much. So it started, Kerala is big hype. I did my palliative medicine from Calicut, Institute of Palliative Medicine. So it's very, very strong. Even bus conductors, sadharna alkar, they also know what is palliative care. We follow the NCCN guidelines, that is national-wide guidelines, which there is no change. No one can change it. Kanam, we have a set data which is specific for each cancer. Namla adu matram follow cheyadullu. So it's not different in India, it's not different in the UK or US, because yes, they might be having phase 1, phase 2 trial drugs which have not come out to us. But, that's still in the phase 1, phase 2 trials. We have drugs which are also good enough to treat our cancers. It's nothing different. Basically, the diet and your mental habits, your diet, your other habits, drinking, smoking, then even your, your stress levels, work-related stress levels, if you're a very emotional person, adindiyam stress levels, family stress levels, all those things. Pinna comorbidities, ആർക്കെങ്കിലും hypertension, diabetes, hypothyroidism, അങ്ങനെയൊക്കെ ആൾക്കാരും സൂക്ഷിക്കണം. പിന്നെ നമ്മുടെ ഭക്ഷണം, mostly grilled food is very much in nowadays. it tends to go to stomach cancer. That's one of the things. That's on a long run, but not immediate. Those diets and all, eat lot of green veggies and, you know, lot of fibers and stuff, like grow your own plants rather than getting it from the market like Lulu or anything else. Better you grow your own vegetables without fertilizers and anything else. That's called organic food. So those kind of things we have to keep in mind. If it runs in the family, you can't help it. You have to take even more care than what it is. Ideally, like if the patient has been working before, he can join up his work to keep his mind, busy. Then normal, exercises, walking, little exercises, mellow exercises. Then doing, I told you, like things that will refresh the mind, like gardening or, some kind of activity, like some music, joining some music club, going to clubs, being with, friend circle, vanam. Those kind of small things are there. Pinna diet, obviously, diet control, vanam. You should be more cautious. You can eat anything, but you're more cautiously done. Got to be more happy in life, that's it. Spend quality time with the family that you have and spend good time. This is what I can tell.